My name is Dr. Michael Palese. I'm a urologist in New York City working at the Mount Sinai Hospital. I'm going to be presenting today a brand new single-use digital cystoscope from Ambu Medical called the aScope for Cysto. We'll be using it in a patient that underwent ureteroscopy and has a stent in place, so we'll be doing a cystoscopy with stent pull. And I'm excited to show you this new technology. This is a fantastic new piece of equipment that we've started to use at our practice here in New York City. As you can see, this is a single-use disposable scope that has many of the qualities that my reusable scopes have. It has a chip at the end where there are no wires going through the actual scope itself. The deflection on this is 120 degrees versus 210 degrees, and also allows us to place instruments at the tip and through the working channel. The image is fantastic. It's as good as, if not better than, the reusable scopes. In addition, because it's a brand new scope in every use, I'm not concerned about infection or cleaning issues, and certainly it creates efficiency in our workplace. So as you can see, we're navigating through the bulbar urethra, entering into the membranous urethra, and here you see the urinary sphincter. The vira montanum is below us as we're now entering into the prostatic urethra through the bladder neck and now into the bladder itself. Once inside the bladder, we're taking a look around, making sure there aren't any foreign bodies or objects. We know that our stent that was placed into the right ureter. It's been in for a few weeks, and you can see that it's quite calcified, and so we obviously want to make sure that we remove this in its entirety. So as we're looking through the bladder here, we're identifying where it's coming out of the right ureter, and we're getting ready then to pull this stent using one of our graspers. And the nice thing about the aScope for Cysto is that the working channel is quite large, and so putting in any standard grasper is quite effective in removing or being able to remove any sort of foreign body or stent for that matter. And so you can see here we're grasping the 8 French stent in this case. We're doing this quite easily, able to pull it then through the urethra, and the patient has no complaints at this time. So we know from a technical perspective that the aScope for Cysto is a wonderful product, but where we're really seeing efficiency and we're really seeing its advantages is in our clinical practice. In many of our offices where we have startup places where the aScope for Cysto just allows us to hit the ground running. We don't have any startup issues in terms of bringing in equipment, especially cystoscopy, which is one of the cornerstones of urology. We're quite excited about this technology. I'm excited to see it being used more and more as time goes on, and we will continue to partner with Ambu Medical in the future.